When Joe Biden is sworn in as president 9 days from now, he's promised to hit the ground running with big plans to overhaul the country's troubled vaccine rollout. Step one, release nearly all the available vaccine doses right away to get more people their first shot quicker. It's a big break from the Trump administration's policy, which has been to hold back millions of doses to make sure second doses are available when they're supposed to be given. And Biden, of note, did get his own second dose today, as did our next guest, by the way. But with 25 million vaccines distributed and less than 9 million first doses administered so far, it's not clear to me availability is the problem in this rollout, with several reports of vaccines going unused and having to be thrown out because administrators can't find enough people who are cleared for their first doses and willing to take them in time. And all the while, the pandemic is spinning further out of control by the day. We hit yet another record high for daily deaths in the U.S. over the weekend, more than 4,100 people Saturday alone, and many hospitals across the country are at or nearing capacity. In Massachusetts, we're averaging around 5,000 new COVID cases a day and have seen several days above 7,000 cases recently, prompting Governor Charlie Baker to extend statewide restrictions that were originally supposed to let up today. But my next guest says that likely won't be enough, predicting we're headed towards more lockdowns after a holiday surge. Dr. Abraar Karan is an internist at Brigham and Women's Hospital and Harvard Medical School. Doctor, thanks so much for joining me.
Thank you so much for having me.
You were quoted in that piece about a week ago saying a lockdown was imminent. Is it all about the Christmas surge? Is it about the likelihood of the variant being around? What is it about?
I think that all of these factors that you mentioned are playing into this. So we have a more transmissible variant that we are now detecting and has probably been here for longer than we first detected it. On top of that, we had Christmas and we had the New Year's as well. And so we expect increased transmission. Now, the difference right now versus earlier on in the epidemic is that we have a vaccine rollout going. And so we have a goal that we're working towards. And so when I had sort of tweeted about the possibility that we may need a next round of lockdowns, what I'm really getting at here is that we need to do two things. We need to be vaccinating people as efficiently and effectively as possible. We also need to slow down transmission as fast as we can.
I want to get to the vaccination issue in a minute. You also said something in this Boston.com piece. It was pretty heavy. You say people dying without access to hospital beds, which is incompatible with re-election, will get action from politicians. I know that that's the situation where you're from, in L.A. County, Los Angeles County. Are we approaching that point that there are no available hospital beds here in Massachusetts?
Well, you know, I don't have the exact numbers with me in Massachusetts. As of now, it seems like we're still managing, but, you know, our hospital systems are definitely under strain. And the problem is when you have exponential spread of the virus, you cannot scale up hospital capacity as quickly as the virus spreads. And one of the limiting factors is staff. You know, a lot of staff around this country are exhausted from this entire year of fighting the pandemic.
Well, speaking of staff, if I may, last week the governor said that if our bed capacity was surpassed, I think 80% may have been the number, that the ratio of nurses to patients in ICU could be broken. I think it's 1-to-1 and 1-to-2 in circumstances where the patient is fairly stable. The head of the Mass Nurses Association today, Katie Murphy, who actually works at your hospital, Brigham and Women's, said that that prescription, that increase in the ratio could be, quote, deadly. Do you agree with her?
Absolutely. Absolutely. So, you know, in LA County right now, where some of my colleagues work, one of the hospitals had a ratio of 1 ICU nurse to 5 patients. And we know that nursing is one of the most important things in terms of patient outcomes and critically ill patients. You need somebody that's watching you closely. And when our nurses are burnt out, we're in big trouble.
So what's the staffing solution? There isn't one, is there?
No, I mean, you can't just bring these extremely highly trained staff out of thin air. You know, we need a better system nationally to move staff around and help places that are hard hit.
You know, the goal obviously is to get to a vaccine alive, and I don't even mean that as a joke. I mean, that is the goal. One of the ways to get there is masks, and I don't know if you've seen this video. This is a Democratic congressperson from Delaware. Her name is Lisa Blunt Rochester. She's handing out masks to a group of Republicans who weren't wearing them during that lockdown, during the attack on Wednesday. Every single one of the Republicans refused that mask. And the reason I bring her up is I know you have co-written a letter to the Biden transition team arguing that high filtration masks, I assume that means the N95s, high filtration masks be sent to every household in the country. And while I love the idea, isn't Blunt Rochester right that that isn't the problem? The problem is not availability. The problem is unwillingness of a significant part of the population still to wear them even if they're available. Is that not the case?
Well, think of it this way. Nothing that we do in the epidemic is going to be done 100%. You need to do every different intervention, and it's all additive to the point that you can get the reproductive number, which is a measure of how the virus is growing, to get below 1 so that it starts to shrink. Now, if you were to tell me that people around you are not wearing masks, I would say it's an even more of a reason for you to have access to a higher filtration mask. Now, we need masks that do two things. One, that protect the wearer, and two, that if the wearer happens to be infectious and they don't realize it, because as you know, you can be infectious without any symptoms, that the mask actually will also stop that person from transmitting to other people. And when you do that, you effectively stop transmission. The more people we can get this to, the faster the epidemic is ended.
Can we spend the last minute on the vaccines? I'm not clear in the case of Joe Biden that he's attacking the right problem either. The goal is to get all the doses out, not to hold any back in the hopes that they can manufacture a second doses quickly enough. But again, we have only 1/3 of the doses that have been distributed that have actually been administered. So again, it seems to me the problem is not releasing all that has been manufactured. The problem is sticking people in the arm like you were today.
Absolutely. So the key here is not just vaccines, it's vaccinating people. And operationalizing that means you have to look closely at the supply chain, you have to look closely at the process and see where the bottlenecks are. If the bottlenecks are in staffing, you can send tons more vaccines out to different communities. They're still going to sit in freezers until you can get the staff to administer them. So we need to be really nuanced. We need to be smart about this and figure out where those bottlenecks are and get the staff there if that's the problem.
I only have 30 seconds left, Doctor, but as I said, you and Joe Biden had the same experience on the same day today. He got his second dose. You got your second dose. What does that feel like? And again, I don't mean in your arm. I mean psychologically. What does it feel like to get that second dose? We only have 20 seconds left.
It feels incredible. You know, I've taken care of patients this whole year, all of last year, 2020, from March all the way until now. And there were so many times we'd go into those rooms and we want to be there for our patients. But we also want to know that we're protected. A lot of us go home to families who are vulnerable. So getting this vaccine means everything to us as healthcare workers.
We can see it on your face. Congratulations on that. And thank you for your work, Doctor. It's good to see you. Thanks for being here.
Thanks so much. Appreciate it.